Hi guys, welcome to Podiatry Practice Mastery. My name is Don Pelto. I am a full-time podiatrist in Worcester, Massachusetts, and I am here to help you with any of your problems in your practice. I hope you find these videos simple and insightful, and I'd love to hear back from you. Okay, so please comment underneath these videos. Please subscribe to the page.
Hey guys, Don here. Welcome to Podiatry Practice Mastery. Welcome to the weekly update. Last week I went over my patient presentations, and this week I'm going to go over something I call my foot treatment checklist. So let me explain kind of the whole backstory behind this. When I started to do these presentations for all of the patients, basically they're a list of PowerPoints that I do that are in full screen mode, and I do that with each treatment room. You can do it with your computer, you can do it with an iPad, you can do it with whatever. What I found is I was talking about a lot of things over and over, and my patients weren't remembering, and it didn't really give them anything to go by, to remember. So I was struggling with that. So I was doing these presentations. The first one, as I mentioned last week, if you didn't watch the last one, was on my pre-surgical discussion. And then my second one was on a plantar fasciitis. That was the one that I was doing after that. And I really liked doing the one on plantar fasciitis because it helped my patients, so on and so forth. But then when I was doing it, it got kind of complex. So I'm going to start over and just kind of show you the slides here. Again, I'm putting my head down here because that's where my light is, my dome light here. So let me share my screen. Okay, remember, this is this patient presentation tool. So if you want to get this, you go to patientpresentations.com and you'll get a link to this tool. So let's talk about a real simple, not simple, no condition is simple, but this is the one I use quite a bit. It's on Achilles tendonitis. Okay, so for Achilles tendonitis, when I show it to patients, I'm going to talk about Achilles tendonitis. I'm going to ask them how long they've had symptoms, what treatments they've tried, how it impacts their life, and then why they want treatment now. I think these are important things to know. These things we're already asking our patients. This is the anatomy slide I call. And so I go over the anatomy, I go over why it pulls in the back, I talk about insertional Achilles tendonitis, and then non-insertional Achilles tendonitis, the same thing we all do. I go over the diagnostic exam right here, and I talk about the x-ray, and I'll show them their x-ray, and then I'll talk about possibly doing an ultrasound. And usually I save the ultrasound for the next visit. So usually not the same visit, but this really helps them to understand the importance of ultrasounds. And this is what I call my I don't know, my salvation slide, my money slide, whatever you want to call it. This is called the treatment evaluator. And the reason I use this for patients is it makes the treatments a lot more objective than subjective. So if you look here, I say, we have certain treatments that some are most effective, some are least effective. And I'm going to focus on three things. You can't just treat one of these. You have to reduce the pain, reduce the tightness, and reduce the stress going through your foot. And I always say my patients usually try things underneath the yellow line first. And then if that doesn't get better, then we'll go to the next step. I say, we tend not to do cortisone on Achilles. And then as I'm going through it, a lot of times I'll go through it information-wise. I'm not going to go through everything, but as I'm explaining this to patients, I'm going to say, okay, so to start, and I'm going to tell you verbally what I say, and then I'm going to show you on my thingy here that's called the foot treatment checklist. What these are, it's like this is a prescription pad. We don't use prescriptions anymore. Everything's electronic, but I still use these paper things. And I just leave this in my pocket. And so when I go from patient to patient, I pull this thing out and I'll explain how to fill it out. But what my words are to the patient, I say, well, have you tried a 2-week course of anti-inflammatory? And if they haven't, I will prescribe that. I'm usually going to give something prescription strength for a couple of reasons. One, I can do what we call medication management when we're talking about billing office visits, so it bumps up the level of the office visit. And second, I think patients, they also feel like they're getting something that's like doctor prescribed versus just over the counter. And then I explain to them the whole thing. If they're taking periodically, it doesn't really do a great job at reducing inflammation. It reduces pain. So I'll start them on that. I'm going to have them do icing and then a contrast bath, and I explain what that is. It's 5 minutes in ice water, 5 minutes in hot water, and then 5 minutes in ice water. And then I'll just introduce the topic of shockwave and amnio. The reason these have these hyperlinks here is because if you're doing the presentation and you click it, it'll go to explain more about shockwave. Okay. Now, reminder, when you go backwards, you can't hit the back space. You have to hit this arrow button to go back in the presentation. So if we're going to do amnio, so I don't usually start out with these, but these are here so I can introduce the topic. The second thing is if they have tightness or equinus, which most of them do, I'll have them do a night splint because of the equinus, and then I'll have them do foam therapy. For me, what works best is foam rolling. And then I'll say, if you're not getting better, go to physical therapy. And then over here, they're usually trying over-the-counter arch supports, maybe a heel lift. And then depending if it's appropriate, I may have them do like an UFO sandal or a new shoe or an orthotic. It really depends on their foot type. I don't normally do walking boots or AFOs initially, but there's information on these. So once again, if you click these hyperlinks, it's going to go to that section of the presentation if you need that. Okay, so that's the verbal. Now, but the whole struggle I had is I was going through all of this and the patient said, yes, 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 but they wouldn't remember anything. And that's where this idea of the this patient treatment evaluator. This is my newest version. I'm on version number 2, and make sure don't do, you guys are going to laugh at this here. So don't do what I did. Okay. So I printed these out and I paid like $500 for these. If you want to look, don't buy as many as I was going to try to get a discount on them. So if you want to use mine, you can, but I have like a whole bunch of these. And so if I was going to do it over again, I maybe would print like 20 of them. And the reason for this is because I did a typo, and I've got all these here, and it just made me so upset. So let me explain what the typo is here. It's this text number. So we have this like HIPAA secure texting, and this number is wrong. This is like the old number, and so I got all these things here. I don't have the courage to throw them out, so I'm trying to use them, but it takes forever to use like one pad. Anyway, okay, I digress. Let's go back here. So the foot treatment checklist, what this is something that has your name on it. I put a texting question because I don't want to get emails. I don't put my email anymore. Office phone number, our 2 office locations. Okay, so what I would do is I would put their name here. Actually, I have one that's filled out, but let me go over this. So name, date, diagnosis, when their next appointment is, what we did for imaging, and I might circle what we're going to do next. What we're going to do for treatments, like if they're doing anti-inflammatories, icing, contrast baths, patient education genius, I'm going to go over in the next video. And then what they're going to do for tightness, what they're going to do for shoes, and any notes. Okay, this is like version 2. Probably version 3 will be a little bit different. And so then when I fill it out, it looks something like this. So I'll put in name, what they have. I put X because I did an X-ray today, and I just circled it, and I'll say, next visit will determine what we're going to do. And the way I kind of explain that is the second visit, I'll do an ultrasound. And based on the ultrasound, if there's a lot of thickness and effusion, then I'll most likely do shockwave. If there's normal thickness and just some effusion around there, then I might do a cortisone injection. Okay. So that's, and then we talk about they're going to do foam rolling. They're going to do night splint, towel, stretch, UFO sandals, custom orthotics. This is a patient that I did for plantar fasciitis. So I just want to show this has really helped out a lot. I know it takes a few minutes, but what are some of the other options? So some of my colleagues, they just type these out in patient instructions. I just find that this is a lot quicker for me to fill out for them. And this is mostly for musculoskeletal things. As you can imagine, I can use this for metatarsalgia. I can use this for plantar fasciitis, Achilles tendonitis, and so on and so forth. So if you want this, you can just like screen capture this and bring it to your printer and have them print it. If you want my printer person, let me know. Just don't order $500 worth. How many of these pads? I'm still upset here. We call them foot pads. Oh, I made 4,000. So maybe you should make 500 versus 4,000. Okay, it might cost you a little bit more pad. I was like saying I'm going to save money on the pads. That's what I was thinking. I was gonna, because it went from like, I don't know, $20 a pad to, I don't know, a lot more. But it's don't do 5,000. Don't do 5,000. But the company is HB Printing. They're in Framingham, Mass. HBprints.com. You can just say you want mine and just have them put your logo and your colors and everything else on there if you want that. But hope you enjoyed this. If you want to learn about my patient presentations, go to patientpresentations.com. That's where that's going to be at. And next week, I'm going to talk about how I use this kind of in conjunction with something called Patient Education Genius. That's what we're going to talk about next week. Okay. Hope you guys found this beneficial. Thanks.